Well, Catherine, top of mind right now is testing availability. We've watched people line up at sites like this one over the last few weeks, but some experts say that testing too soon after an exposure can lead to unreliable results. Experts say you should evaluate risks when seeking out a COVID test, such as, are you vaccinated? And do you plan to spend time with people at risk, such as young children? One Portland State biology professor says he recommends waiting until symptoms develop before testing, even waiting on a few days of symptoms.
Wait until you test, because the first thing is it actually takes a little while before, if you're infected, the virus gets up to a level that's high enough that the tests, particularly the rapid tests, will actually be able to detect it.
Carlos Crespo is a public health professor at Portland State. He says if exposed, people should take an at-home test, self-isolate, then test again. Crespo tells us even if you're asymptomatic, a positive test is a helpful public health tool.
Just to know where the outbreak is, just to know where the hot spots are, you can, direct resources, et cetera. That's primarily a public health surveillance.
The professors say the CDC recommends 5 days for isolation as an average. Some people could be infectious for a shorter or even longer period of time. Another factor is if you live with someone who tests positive. If that's the case, experts tell us it is possible to test negative several times before ultimately testing positive.
Over the past 2 years, some say they've seen more new patients reaching out for help. According to data from the U.S. Census Bureau, more than 50% of people 18 to 29 who live alone have symptoms of anxiety and depression. Same goes for people 30 to 44. As K2's Francis Lynn reports, many say that those feelings stem from a loss of social activity. So, Francis, you spoke with someone who's feeling just that. What did they describe to you?
They told me it's not only the lack of social interactions, but everyday life as well. Everything is so different now. Quarantine, social distance, don't gather in large groups. Doctors' advice we're so used to hearing now to keep us safe from COVID-19. But now that it's been almost 2 years, the lack of social interaction can be draining.
Terrible. I feel really, really terrible. It seems like there's all these false hopes.
David Walker is a writer. He says he used to travel to go to conventions and shows.
Probably 95 to 99% of my actual personal interactions have been gone.
And not only that, his daily life has completely changed.
Every interaction that you have is, potentially you getting infected.
Even going to get coffee can be a hard decision.
Especially if you've got people in your life like older folks or people who are immunocompromised. You don't want to get them sick just because you wanted, your iced vanilla latte.
And mental health professionals are seeing the same struggles.
My practice it's probably seen anywhere 35 to 40% increase of people coming in specifically around the pandemic.
Licensed clinical social worker John Wolf says if you're one of those people feeling COVID strain, remember to follow a simple acronym, RED.
R for rest, E is exercise. And so what we suggest is moderate level of exercise. Diet. The last one, the D, is for diet. Watch those calories and carbs. But all in all, with those things in mind, you also want to be optimistic.
Wolf says don't focus on when this is going to be over, but instead focus on how you can cope.
Well, Catherine, after several team members tested positive, you can see Mothers decided to suddenly close with plans to reopen in early February. Staff tell me this comes during a time when less customers are dining both outdoors and inside, and they felt this was the safest decision. The owner at Mothers says as the year started, the writing was on the wall.
We had one week, one COVID case, then one the next week. And then when I heard a mother-daughter who worked for us were also sick, I said, okay, one more and that's it. We've got to close. And that was it.
This comes as restaurants across Portland are noticing a drop-off in foot traffic. Staff at River Pig tell us this is the slowest January they've ever seen.
Definitely, this is one of the more challenging ones because, Omicron started hitting hard in every industry. but more than ours, since we have a lot of customers. A lot of customers are like scared to get into into the business again, so go out and eat.
Mother's stayed closed for months in 2020. The owner says she wants to ensure her restaurant is not a place where the virus spreads.
We want to believe that it's over, and it's not. And it's just a sad smack upside the head telling us, you know what, we still have this to deal with, and it's not going away anytime soon. So we've got to learn how to be flexible, and we are definitely learning how to be flexible with these opening and closings.
The team here also saw this as an opportunity to give back. When they decided to shut down suddenly, the restaurant was stocked for a busy weekend. Ultimately, mothers donated the food and beverages on hand.
We just had a ton of food left over, and thankfully the Blanchett House is nearby. Thankfully, I've got a chef de cuisine that's got a pickup truck. So we found a good place for the food to go. We loaded it up and we brought it to them, 2 full truckloads, 500 pounds of food.
Staff here say they are optimistic about welcoming customers back by February 3rd. I also asked the owner how employees are getting by during a month without pay. I'll show you how she's stepping in to help there as well, coming up tonight at 6.
Experts say even though it didn't cause a lot of damage, it's still a good reminder for people along the coast for if and when this happens again. This may not seem like a big deal, but experts say under a tsunami warning, anything can change in a second.
Should we run? Should we do?
Patty Brockman heard the sirens this morning on Cannon Beach.
A very loud speaker that explained that this is a warning, stay off the beaches, stay off the pier, and all of that. Some of the people I work with said they've lived here for 10 years. They've never heard tsunami warning, actual warning signs, sirens.
She experienced quite a few weather events in the short month and a half since moving there.
We've had a wind and rainstorm that took a tree fell down in front of my car one night. Then last week we had a wind rain event. I think we got 5 inches of rain, and the streets flooded, and I couldn't get home for 2 days. And then this morning, by the time the warning sirens were blaring at about 10 o'clock when I was at the work, I was a little freaked. What's next?
Experts say even though we didn't see a lot of damage, this was still a good reminder for people living out there.
It just shows that we have to be vigilant. This is a good reminder and a wake-up call that tsunamis are a possibility.
So remember, it could be small waves for now, but it could change in a moment's notice.
The water may recede and rush out and then come in a big surge that is moving a lot faster than you can outrun it. There is no question. You don't know that a surge of water isn't coming that could be really dangerous.
Tobin says this volcano eruption is historic and they'll be studying it for years to come.